India has a new crisis in front of it in form of cancer. What is India's cancer map and how it explains the rising cases and what government is doing about it? Did you know 1 in every 9 Indian is likely to develop a cancer in their given lifetime? And these numbers are changing very fast and making us vulnerable in terms of the cancer landscape that we see in our country. The question is, what are these numbers indicating, how we can learn from them, and what government is doing about it? Hello everyone, welcome to Vajram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to talk about India's cancer landscape. We are going to understand that what is India's cancer map, how it presents a different number in front of us and how this needs to be addressed like a crisis situation, because that leaves us vulnerable not in just terms of lives but productivity as well as society. So let us begin with understanding a few numbers. The one with which I started was that 1 in 9 Indians is expected and is at the risk of developing a cancer. That means almost 11% of our population remains at that risk. And if we look at the recent estimates, now these estimates have been given for the last year, because as of now, just to give you an insight that how much we lack in terms of data, the data that lies in front of us has been taken from 43 cancer registries across the nation. Right? Now this data that is in front of us is of 2015 to 19, and after that 2020, 21, 22 data is not adequate and it is not used because of the effect of COVID-19 pandemic, and even after that the registries are lacking. So here we find that the loophole or the crisis is not in terms of this disease itself but also in understanding the estimate. So the estimate that lies in front of us is the fact that we already have 15 lakh more cases, but this number is hugely missed because this could be way more than this what lies in front of us, and it has led to already more than 8 lakh deaths. Now this clearly indicates the fact that the incident has gradually increased. If you look at the more recent numbers which are coming again from National Cancer Registry, which presented their data in the parliament, it shows that 15.69 lakh people had shown the incidence of cancer in their lifetime and the mortality is not seen. But if we talk about the numbers which have we seen previously, this numbers has gradually increased only with the time. And the incidence of cancer is more likely in females as compared to males. But that is not the comparing point. The comparing point is the fact both of these genders suffer from different kinds of cancer. For example, if you talk about lung, mouth, prostate, tongue and stomach cancer, it is usually seen in male. The prominence is higher in males. But if we talk about breast, cervix and ovary, uterus lung cancer, it is present more frequently in women. Now, out of this also we have seen a few direct trends in the data. Let us look at that as well. When we are talking about cancer as a disease, we are seeing gender disparity here as well. When we are talking about females where 51.1% of cases are present, but the death or mortality is only 45%. That means the survival chance is better because the cancers which we are seeing, for example breast cancer or cervix cancer, they are detectable by screen and they are treatable as well. However, when we are talking about men, then we see higher share of deaths even though the incidence of cancer is comparatively lesser than females, because the detection in such cases is late. The cancer is of aggressive form, be it oral cancer, lung cancer or stomach cancer. And as per the NCRP, it clearly projects that 1.57 million cases will be there by 2025, and that is a stark 12% rise that we are going to see from 2025, and it has been linked not to just aging but also lifestyle risk as well as better diagnostics. So here the situation clearly indicates that cancer as an issue, cancer as a disease, cancer as a crisis, which not only affects the individual, the family, the society, as well as our medical infrastructure. It has the causes rooted not just in age, but the changes that we are going through in terms of lifestyle. Now moving ahead and looking into more data that lies in front of us and understanding the key trends when we are talking about specifically the cancer incidence. So as per the data, if we talk about oral cancer in men, it highlights the fact that it is most common in men and it is already surpassing lung cancer. Furthermore, we have found that there has been reduced tobacco use, and the latency period is the one which is explaining that why we are seeing rise in oral cancer. It is an ironical situation, of course, when the tobacco use has gone down, but the latency period is the main reason in this situation that we are seeing higher oral cancer incidence. Furthermore, alcohol consumption with tobacco, this combination which has seen more surge in recent times, is the main cause which compounds the risk of the oral cancer. If we talk about female cancer patterns, if we talk about women cancer patterns, we find that breast cancer is the leading cancer which is affecting women across India, and cervical cancer is gradually showing decline, and that is because of awareness which is facilitating the diagnostics in terms of screening, and HPV vaccine which is facilitating the prevention of this very disease. Furthermore, let us also look at the cancer map that we were talking about in the start. Now when we look at this map, we found the incidence rate for males as well as females across our country, and as per the research you can clearly see that the incidence for males is higher in the northeastern region, it is higher in Karnataka, Uttarakhand, as well as when we are talking about females, we still find the incidence higher in Karnataka as well as northeast. Now the detailed understanding of this trend has come through the given data which shows regional disparity in terms of cancer incidence as well. So when we are talking about northeast itself, it has been labeled as the cancer hotspot, as while in Mizoram, which is celebrating as of now getting its railway for the first time in last 78 years, it is the highest, it has the highest male incidence, and if we talk about Papum Pare in Arunachal Pradesh, it has the highest female incidence as well. The reasons mostly are the non-awareness which is associated with tobacco chewing, smoking and eating fermented foods, furthermore HPV infections and the lifestyle factors. Other than that, we are seeing the lowest incident when we are talking about Osmanabad and Bir districts in Maharashtra, but this should draw our attention to the fact that Northeast is asking the question that medical infrastructure and awareness and safety should reach these citizens as well. So understanding the incidence of this particular disease is part of understanding how big and prevalent this is as a problem and how urgently it is calling for attention, not just from other parts of the country but from the government as well. So when we are talking about all these data, the one thing that should definitely come in your mind is the fact that what is actually government doing about it, what are the things that are being facilitated for the citizens so that they are better equipped to fight with this particular disease. When we are talking about this, the first thing we need to understand before talking about government, that these data, these trends are the fundamental basis of understanding the problem itself. So these trends are clearly highlighting how this matter is important for public health. That means it is giving us an insight. What is the insight? For example, when we are talking about rising oral cancer, it highlights the fact that how we need to control tobacco as well as alcohol usage through policy so that this oral cancer rise can be controlled. Another example, for example, screening. We have seen screening actually works. That means if there is early detection, that means life can be saved. Be it breast cancer or cervical cancer, it has shown that early detection can lead to saving of lives, and that should be what is to be focused on. Other than regional hotspots should be dealt as crisis zones, they need the most focus. So Northeast requires a different customized campaign which can actually focus on the targeted reasons because of which we are seeing incidents of cancer in these particular places. Furthermore, it also highlights that there is scope for preventability. That means we can focus on prevention because prevention is definitely better than cure. So if we are talking about WHO, it clearly says 50% of the cancers are preventable. How they are preventable? They are preventable by me and you itself, by a healthy diet, by exercising, by avoiding tobacco, by avoiding alcohol, and using appropriate vaccines by the consultation of the doctor itself. So in such cases, it becomes very important to understand that how these trends are an alarm and also an insight for public health. Another thing highlighted is the economic burden. Cancer itself is an exhausting, depleting disease which kills the human mentally as well as economically, because the treatments are expensive and we need to bring in financial protection schemes which are very important so as to protect the patient as well as the families so that they do not fall into the visage of poverty itself. Now let us move on to the question that what is government doing about all of this? So when we are talking about government, the first main scheme that we should know about is NPC DCS. When we are talking about NPC DCS, it is basically the national program for control of diseases such as cancer, diabetes and stroke. Now this has two main fractions which talks about community screening, where we can deal with oral cancer, breast cancer, cervical cancers, and it also has provision of district NCD clinics and CHC NCD clinics for all sort of early detection as well as management. Then we have financial protection schemes. For example, Ayushman Bharat scheme which gives 5 lakh per family for cancer treatment in impaneled hospitals. We also have Home Minister's Cancer Patients Fund which gives up to rupees 15 lakh for below poverty line families in the regional cancer centers. Apart from that, a different segment is dealt in terms of infrastructure expansion. So government is also focusing on expanding the medical infrastructure related to cancer and oncology, where we are seeing that 19 state cancer institutes plus 20 tertiary care cancer institutes, daycare cancer treatments and centers, so that the care is available to the cancer patients closer to their home. And then the focus is also on affordable medicines, where Amrit Pharmacies, PMBGP, they are focusing on providing discounted cancer drugs, implants, chemo medicines to the patient. And last but definitely not the least is the vaccination and awareness. When we are talking about awareness, this is the change that we need to bring all so that this cancer incidence map of India changes and we can get rid of this crisis at the earliest. Now, what do you think about all this? Let me know in the comment section. That was all from my side. Thank you so much.